The use of development communication within the health sector is of great interest to me. This is why when I learned about the act of female genital cutting in parts of Africa and how development communication is being used to try to eradicate it, I knew this was going to be the focus of my project. Because some of you are also taking the Issues in Women's Studies course, they're very familiar with this topic. For those of you who have not taken this course, I'd like to explain more about what female genital cutting is, adverse effects of this act, why populations continue to conduct female genital cutting, the Western view and effects of globalization, and the use of development communication to help eradicate this practice. Thus, my research question is, how has globalization and development communication impacted the practice of female genital cutting in Africa? So what is female genital cutting? Female genital cutting, according to the World Health Organization, comprises of all procedures that involve partial or total removal of the external female genitalia or other injury to the female genital organs for non-medical reasons. There are 4 major types of female genital cutting. Type 1 is a clitorectomy, type 2 is excision, type 3 is infibulation, and type 4 includes all other harmful procedures to the female genitalia for non-medical reasons, such as pricking, piercing, incising, scraping, and castorizing. Female genital cutting, or FGC, is usually performed on girls between birth and age 15. This practice is most common in the west, east, and northeast regions of Africa, in some countries in Asia and the Middle East, and among migrants from these areas. In Africa, about 101 million girls aged 10 years and above are estimated to have undergone FGC. So what are adverse effects of FGC? FGC has no health benefit and may cause long-term adverse effects. The literature on adverse effects varies greatly. WHO, or the World Health Organization, states that FGC causes long-term effects including recurrent infections, cysts, infertility, and the need for later surgeries. In the study Female Genital Mutilation and Obstetric Outcome, WHO Collaborative Prospective Study in 6 African countries, it was concluded that females who have undergone FGC are at greater risk for postpartum hemorrhage, extended maternal hospital stay, need for C-section, need for infant resuscitation, stillbirth or early neonatal death, and low birth weight babies. In the study, long-term reproductive health consequences of female genital cutting in rural Gambia, a community-based survey, it was concluded that commonly cited negative consequences of FGC, such as tumors, painful sex, infertility, and other reproductive tract infections, were not significantly more common in cut women, but there was a higher prevalence of herpes simplex virus and of bacterial vaginosis in cut women. So why do populations continue to conduct female genital cutting? When learning about how the practice is not necessary and how it can adversely affect a woman's health, one may wonder why people continue this practice. The major driving force behind FGC is that it is a long-standing cultural practice. I actually watched a documentary called Neuro, A Story of Female Genital Mutilation, which allowed me to see the practice from the perspective of those who participate in it. It became apparent that this practice is a very important ritual that has been passed down century after century. There are many beliefs among societies who perform this procedure, including that if not performed, the girls will die, it will bring bad luck upon the community or family, and that it will maintain a girl's virginity before marriage. It is a girl's rite of passage in these societies, and the entire community participates in celebrating. If not performed, the girls will face social stigma and will be seen unfit to marry. While conducting my research, I found that globalization has greatly affected the practice of FGC. Concepts I will be covering in this part of my presentation include propaganda, international law, immigrants or diasporic groups, double standards in the Western stance, and the use of ICTs. I was surprised to learn that propaganda actually played a big role in raising awareness of this practice internationally and obtaining a growing opposition towards it. The term female genital mutilation was used to make the practice sound horrific. The women in these societies were made out to be passive and submissive, and when stating health effects are usually exaggerated and depict rare case scenarios. Due to the growing opposition towards FGC, the United Nations at the 1993 Vienna World Conference on Human Rights classified female genital mutilation as a form of violence against women. And violence against women was, for the first time, acknowledged under the international human rights law. As stated in the article, Female Genital Cutting, Cultural Conflict in the Global Community by Schmier, the international norm that allows countries to determine their own cultural matters is challenged by the universal human rights perspective. Since this time, there has been international pressure on African countries to pass laws against FGC. The problem with these laws are they're not always enforced. People are starting to have FGC done on girls at a younger age, and because not all countries in Africa have banned this act, people are traveling to countries without these laws to have FGC done on their daughters. Because globalization and international migration of populations who perform FGC, there has also become a need to have laws against FGC in Western societies. A quote stated by Poulter in the article, Cultural Rights Are for Human Rights, the Case of Female Genital Mutilation, that cultural tolerance obviously cannot become a cloak for oppression and injustice within the immigrant communities themselves. There are two approaches in the international campaign against FGC, which include the health approach and the human rights approach. Using both approaches has proved to be the most successful method at combating FGC. Major rights-based claims include the rights of the child, the rights of women, the right from freedom to torture, or from torture, and the right to bodily integrity. Some sources on FGC pointed out double standards amongst the argument against FGC in Western countries. The major double standard mentioned is that of the Western acceptance of male circumcision. Other double standards include vaginal plastic surgery in America, or designer vaginas, and the fact that forms of FGC are present within Western medical practices to make the children normal. FGC in Africa, however, is usually conducted in unsterile environments with no anesthetic on young girls who are not able to consent to the procedure. Communication development, or development communication, defined by our textbooks, International Communication Essential Readings, is the use of communication processes, techniques, and media to help people towards a full awareness of their situation and their options for change, to resolve conflicts, to work towards consensus, to help people plan action for change and sustainable development, to help people acquire the knowledge and skills they need to improve their condition in that society, and to improve the effectiveness of institutions. The problem with many past interventions was the fact that Africans were not involved in the planning process, and their wants and needs were not recognized. According to the article, Old Paradigm in Information and Communication Technologies for Development Agenda in Africa, Modernization as Context, African countries are at a disadvantage because of their inability to influence the global communication agenda, which continues to be set and implemented by the world's most powerful nations. The success of interventions depends largely on their sustainability and acceptance within the local communities. The use of ICTs in Africa to educate local populations on why FGC should be eradicated has been very successful. As stated in the article, Local Conformity to International Norms, the Case of Female Genital Cutting, institutions that carry modern scripts through education, college, mass media, and female employment reduce the probability that women will favor the continuation of FGC. There are also many successful organizations and programs using development communication to help reduce the incidence of FGC. I'd like to share two of these organizations with you. The program Circumcision Through Words provides girls with an alternative rite of passage, which involves a week's seclusion where they attend a workshop to help empower and educate them on their culture, their roles as women and mothers within their community, along with health messages. The organization World Vision focuses on community involvement, re-educating those who actually perform the female genital cutting, created a toll-free child helpline, and work in partnerships with local advocacy groups. To sum up my presentation, globalization has had a large impact on the practice of FGC within African communities. The use of health approach and the human rights approach, international and national laws, the use of ICTs, and organizations using development communication have all helped combat FGC. In order for governments, organizations, and advocates to continue reducing the incidence of FGC, they must approach the situation with cultural sensitivity, involve local community members, educate the masses, and empower women. Thus, that concludes my presentation. So thanks for listening.